I'm the physiology faculty with DAMS. In fact, I've been associated with DAMS for the last 15 years. DAMS, as you know, is the premier institute for PG coaching in India. This year, in 2021, DAMS is also starting with the first year tuition classes. Now, in these first year tuition classes, the 3 subjects of first MBBS, anatomy, physiology, biochemistry, will be covered by our faculty. And just to give you an idea about how we are going to conduct these classes, I'm going to take up a very small topic with you, which is a part of the first chapter in physiology. So let's discuss this, and let's see. The first thing that you'll be taught is what is ICF and ECF, intracellular fluid and extracellular fluid. Now, when you look at extracellular fluid has been called the milieu interior. This is a term which has been given by a very famous physiologist called Claude Bernard. What is milieu interior? Milieu interior means this is the internal environment. Just like the body has an external environment, there is an internal environment, which is the ECF. ECF is the fluid which is surrounding the cells. So this forms the internal environment of the body. Now, there's another term which is called homeostasis. Now, homeostasis, what does this mean? Homeostasis means maintenance of nearly constant conditions. Maintenance of nearly constant conditions of the internal environment. This is extremely important for normal functioning of the body, that the internal environment be maintained in nearly constant conditions. When we talk in terms of maintaining constant conditions of the internal environment, means maintaining the fluid, the electrolyte balance, the pH. These have to be maintained at nearly constant conditions for normal functioning of the body. Now, there are a number of control systems in the body. Now, most control systems in the body function on what is known as a negative feedback. And negative feedback is, in fact, a stabilizing mechanism. Negative feedback mechanisms help to maintain the internal environment in nearly constant conditions, or help to maintain homeostasis. So these are stabilizing. Now, what is the unique feature of a negative feedback control is, in negative feedback, there is a reversal of the initiating stimulus. There is a reversal of the initiating stimulus. Now, let me take a couple of examples here to tell you what do I mean by saying reversal of the initiating stimulus. For example, if you look at the normal mean arterial pressure is 100 millimeters of mercury. Supposing this mean arterial pressure increases to, let's say, 125 millimeters of mercury. Yes, this could happen if there is excessive intake of salt, there is salt and water retention, there is increase in the body fluid, and this increases the mean arterial pressure to 125. Now, one important feedback control system is what is known as the baroreceptor mechanism, which helps to maintain the blood pressure helps to maintain the blood pressure. So what happens is, when the moment the mean arterial pressure increases to 125, the baroreceptor mechanism will be activated, and that helps to reduce the blood pressure and bring it back to nearly normal levels. Now, what happens in the baroreceptor reflex is that there is going to be a decrease in the sympathetic discharge, and when there is a decrease in the sympathetic discharge, the blood vessels dilate, and that helps to reduce the blood pressure, bringing it back to normal. So basically what has happened here is, the initiating stimulus here was 125, increase in blood pressure. The baroreceptor reflex has helped to lower this blood pressure, bringing it back to normal. So that means there has been a reversal of the initiating stimulus. Right? Let's take another example. Now, we said that the normal mean arterial pressure is 100 millimeters of mercury. Now, let's say there is blood loss. Maybe there is a road traffic accident or something, and this individual has lost blood, and his blood pressure now falls to, let's say, 70 millimeters of mercury. Now, again, the baroreceptor reflex will be activated, but in this case now, the baroreceptor reflex will increase the sympathetic discharge. And once it increases the sympathetic discharge, there is a vasoconstriction, and that helps to increase the blood pressure, bringing it back to nearly normal levels. Right? Again, what is the initiating stimulus? Initiating stimulus was this fall in blood pressure. The baroreceptor reflex increased the sympathetic discharge and elevated this blood pressure, bringing it back towards normal. So there is a reversal of the initiating stimulus. This is also a negative feedback. Wherever there is a reversal of the initiating stimulus, it is known as a negative feedback mechanism. Both of these examples come under negative feedback. In both these examples, there was a reversal of the initiating stimulus. And like I said, these negative feedback mechanisms are stabilizing. They help to maintain homeostasis. They help to maintain nearly constant conditions inside the body. What is positive feedback? Now, positive feedback, these are not stabilizing mechanisms. There are very few examples of positive feedback. Now, when I look at positive feedback, I will remember this as claps. Right? A small little mnemonic to remember what are the examples of positive feedback. Like I said, there are very few examples of positive feedback. Clotting. Clotting is an example of positive feedback. Calcium release from the sarcoplasmic reticulum during a muscle contraction. This is also an example of positive feedback. LH surge in the sudden increase in luteinizing hormone just before ovulation is another example of positive feedback. Action potential. The sodium influx producing a depolarization in the action potential is another example of positive feedback. Parturition, shock. These are examples of positive feedback. Parturition is the process of delivery. Let's see this. Let's see why do I call it a positive feedback. Now, if you're familiar with the process of parturition, this is the uterus. Fundal contractions of the fundus, they push the fetal head into the cervix. And this pushing the fetal head down causes a cervical dilatation. Cervix tends to dilate, and this cervical dilatation in turn causes stronger fundal contractions. Stronger fundal contractions will push the fetal head more, cause more cervical dilatation, stronger fundal contractions. So this is an example of positive feedback. Yes, had cervical dilatation inhibited the fundal contractions, reversal of the initiating stimulus, that would have been negative feedback. But in that case, delivery would not have been possible. So what has happened here is cervical dilatation is causing stronger fundal contractions, which pushes the fetal head more, which causes more cervical dilatation, stronger fundal contractions. So this is an example of positive feedback. Another very interesting example of positive feedback is the LH surge, which occurs just before ovulation. Now, luteinizing hormone levels are very low throughout the menstrual cycle, and that is because of negative feedback of estrogen on LH. As estrogen levels rise, they inhibit the secretion of LH. But just before ovulation, this negative feedback of estrogen switches and becomes positive feedback. So what happens is estrogen now increases LH, which increases estrogen, which in turn increases LH. So what happens is just before ovulation, there is a sharp increase in the LH secretion, and this sharp increase in the LH secretion is known as the LH surge. This is the LH surge. And this is, like I said, this is due to a positive feedback of estrogen on LH secretion. And without this LH surge, ovulation cannot take place. So this is important. This is mandatory for ovulation to take place. Now, like I said, throughout the menstrual cycle, there is a negative feedback of estrogen on LH secretion, which switches and becomes positive feedback. What causes this switch from negative to positive is something we still do not know. But there is a switch from negative to positive feedback. LH surge, the LH secretion again comes back to very low levels, again due to a negative feedback of estrogen on LH. Right? So this is another example of positive feedback. Positive feedback, very few examples like I just told you over here, and but negative feedback, most control systems function on negative feedback, and those help to maintain homeostasis. Now, as far as the negative feedback mechanisms are concerned, there is also something known as the gain of a negative feedback system. Now, what do you understand by the gain of a negative feedback system? Now, this is important from a university exam point of view as well, because very often you are asked a question on gain of a feedback system, a short note on gain. You can get a short note on negative feedback systems, you can get a short note on positive feedback systems, and on gain. Now, what is gain? Gain is correction over the error. Correction over the error. Let's take an example of blood pressure control systems. And like I said, one of the most important mechanisms which helps to maintain the blood pressure is baroreceptor. So let's try and understand what is the gain. Now, like I said, the normal mean arterial pressure is 100 millimeters of mercury. Supposing something happens and this blood pressure, let's say, increases to 125 millimeters of mercury. That something could be excessive salt intake, excessive infusion of fluids. This has increased the blood pressure to 125. And the moment the blood pressure increases to 125, the baroreceptor mechanism will be activated and you get a baroreceptor reflex, which reduces the sympathetic discharge and brings the blood pressure back to 105. It could not do 100% correction. It could only lower the blood pressure from 125 to 105. So that means there has been a correction and there is also an error. Yes. So if I see this, what is going to be the gain here? The correction here is 125 to 105. So that means there is a correction of 20 millimeters of mercury. 20 millimeters of mercury. Yes. And I can also write this correction is minus 20. Why minus 20? Because the blood pressure has been lowered from 125 to 105. So we say the correction is minus 120. Have you understood? Now, what about the error? Now, error, instead of the blood pressure now being 100, it's now at 105. It's 5 millimeters more than the normal mean arterial pressure. In other words, the error is plus 5 millimeters of mercury. You understand why I put a plus here? Because the new blood pressure, the corrected blood pressure, is higher than the original blood pressure. So this gives me a gain of minus 4. Have you got my point? Right? Correction over the error. Please understand, the minus and the plus signs do not have any mathematical significance here. The minus and the plus signs have only told me minus was because the blood pressure was lowered and the corrected blood pressure is higher than normal. So we put a plus sign there. Let's take another example. Like I said, the normal mean arterial pressure is 100 millimeters of mercury. Supposing there is blood loss. And the mean arterial pressure now falls to, let's say, 75 millimeters of mercury. Yes? There is a road traffic accident. This individual has lost a lot of blood and the blood pressure falls to 75. The baroreceptor reflex will now increase the sympathetic discharge and try to bring the blood pressure back towards 100. So it could only elevate the blood pressure to 95. It could not take it back to 100. That is probably because of the limitation of the system, right? So that means there has been a correction and there is also an error. So let's try and calculate the gain here. Gain is correction over the error. Now, what is the correction here? The correction here is from 75 to 95. That means it is plus 20. Why did I write a plus here? Because the blood pressure has been increased from 75 to 95. But there is an error now. The error is 5 millimeters of mercury lower than normal. So in other words, the error is minus 5 millimeters of mercury. Again, the gain is minus 4. Again, let me reiterate that the plus and the minus signs do not have a mathematical significance, right? The gain in both the situations, I've told you, has been a -4. Again, in some books, sometimes the gain is written as the sign is not given. It only says the gain is 4. That's also okay, isn't it? Because like I said, there is no mathematical significance here. The plus and the minus signs are only telling you whether, like in this case, plus 20 means that the correction is there is an increase in blood pressure. Error, the new blood pressure, the corrected blood pressure is lower than the normal blood pressure. So this is the concept of gain. Now, to bring an extra point into this topic, something which will give you some extra marks, is this concept of infinite feedback gain. Now, what is this infinite feedback gain? When you get an infinite number, and that would be, like I said, what is gain? Correction over the error. Correction over the error. So if the error is 0, yes, if the error is 0, the gain would be infinite. And there is one example of an infinite gain where the error is 0 or nearly 0. That means the correction is almost to the extent of 100%. And that is the control of arterial pressure by the renal body fluid mechanisms. Right? Now, this is something very interesting, and that is, for example, like I told you that the normal mean arterial pressure is 100 millimeters of mercury. Supposing there is excess salt and water intake, there is increase in the body fluid, in the ECF volume, and therefore an increase in the blood pressure. Now, the kidney, the moment there is increase in blood pressure, the kidney, there is something known as a pressure diuresis and a pressure natriuresis which occurs in the kidney. What is pressure diuresis? That means because of this elevated pressure, there is now more urine formation. And pressure natriuresis means loss of, natri is sodium, loss of sodium in urine. So if there is an elevation of blood pressure, there is now a pressure diuresis and pressure natriuresis by the kidney. That means the kidney now causes excess urine, increase in urine output, and excess loss of salt in the urine, excess loss of sodium in the urine. The idea behind that is to bring the blood pressure back towards normal. Yes? So this correction of the blood pressure, of the ECF volume, and therefore of the blood pressure by the kidney follows the infinite feedback. Are going to be live and interactive on our eMedicoz app. Now, when I say interactive sessions, that means you can ask questions from the faculty. These are not, you're not only going to have these live and interactive sessions, you're also going to have recordings of these sessions available as a backup. So in case you missed a live session, you can always go back to a recording of that session so that continuity is maintained. Now, what are going to be the timings? These classes will be held in the evening for 1.5 hours every day, 5 days a week, Monday to Friday, 2 days for anatomy, 2 days for physiology, and 1 day for biochemistry. The classes will be strictly as per the MCI recommended competency-based curriculum. These classes will be based on standard textbooks. Like in physiology, your classes will be Guyton and Genong based. Special emphasis will be on concept building. This is extremely important because we want you to have a very strong foundation, not just for your first MBBS university exam, but also for the next exam. You know that the next exam will be conducted at the end of your final MBBS. So we want you to have a very strong foundation with special emphasis on the applied part, on integrating, and on the clinical aspects. Doubt solving will be an extremely important part of our classes. You can ask your doubts during the class and even after the class on the eMedicoz app, and the faculty will answer your doubts. You will be given all printed study material. Tests will be an important feature of our classes. These tests will be held weekly or at least fortnightly. What we want to have is a mentor-mentee relationship. We want to guide you through this rather difficult first year. Our goal will be that you should do very well in your first MBBS exams, as well as orient you towards the next exam. You can log on, you can download the eMedicoz app and register on the app. You can use a referral code DRANMED974. You will get a 10% discount by using this referral code. Thank you so much for your time, and if there are any questions, please get in touch with me at dranupamadevkan@gmail.com, and I will answer your queries, if any. Thank you so much.